Everything you need to know about diabetes. Diabetes mellitus, or diabetes, is a metabolic condition that produces excessive blood sugar levels. Insulin transports sugar from the blood into your cells, where it is stored or utilized for energy. Diabetes occurs when your body either does not produce enough insulin, or does not utilize the insulin it produces adequately. If left untreated, diabetes-related elevated blood sugar can harm your nerves, eyes, kidneys, and other organs. There are a few different types of diabetes. Type 1 diabetes is an autoimmune disease. The immune system targets and kills cells in the pancreas, which manufactures insulin. It is unknown what is causing this onslaught. This kind affects around 10% of people with diabetes. Type 2 diabetes develops when your body gets resistant to insulin, causing sugar to accumulate in your blood. Prediabetes is considered as having blood sugar levels higher than usual but not high enough to warrant a diagnosis of type 2 diabetes. Gestational diabetes is known as elevated blood sugar levels throughout pregnancy. Insulin-blocking substances generated by the placenta causes this kind of diabetes. Diabetes insipidus, despite its similar name, is an uncommon illness unrelated to diabetes mellitus. It is a distinct disorder in which your kidneys drain an excessive amount of fluid from your body. Each kind of diabetes has its set of symptoms, causes, and treatment options. Symptoms of diabetes. Diabetes symptoms are caused by rising blood sugar. General symptoms of diabetes. Diabetes symptoms in general include increased hunger, increased thirst, weight loss, frequent urination, blurry vision, extreme fatigue, sores that don't heal. Symptoms in men. Men with diabetes may have diminished sex desire, erectile dysfunction, and inadequate physical strength, in addition to the normal symptoms of diabetes. Symptoms in women. Diabetes can cause urinary tract infections, yeast infections, and dry, itchy skin in women. Type 1 diabetes. Symptoms of type 1 diabetes can include extreme hunger, increased thirst, unintentional weight loss, frequent urination, blurry vision, tiredness. It may also result in mood changes. Type 2 diabetes. Symptoms of type 2 diabetes can include increased hunger, increased thirst, increased urination, blurry vision, tiredness, sores that are slow to heal. It may also result in recurrent infections. This is because high glucose levels make it more difficult for the body to mend. Gestational diabetes. The majority of women with gestational diabetes experience no symptoms. The disease is frequently discovered through a standard blood sugar test or oral glucose tolerance test, generally conducted between the 24th and 28th weeks of gestation. A woman with gestational diabetes may feel increased thirst or urination in rare situations. Causes of diabetes. Each type of diabetes has its own set of reasons. Type 1 diabetes. Doctors aren't sure what causes type 1 diabetes. The immune system erroneously targets and kills insulin-producing beta cells in the pancreas for unknown reasons. Some people's genes may have a role. It's also conceivable that a virus triggers the immune system's response. Type 2 diabetes. Type 2 diabetes is caused by a mix of hereditary and environmental factors. Being overweight or obese also raises your risk. Carrying additional weight, particularly around the abdomen, makes your cells more resistant to the effects of insulin on blood sugar. This disease runs in families. Family members share genes that make them more prone to type 2 diabetes and obesity. Gestational diabetes. Gestational diabetes is caused by hormonal changes that occur during pregnancy. The placenta secretes hormones that reduce the sensitivity of a pregnant woman's cells to the effects of insulin. This can result in elevated blood sugar levels during pregnancy. When they get pregnant or acquire an excessive amount of weight throughout their pregnancy, women who are overweight are more likely to develop gestational diabetes. Diabetes complications. Complications associated with diabetes include heart disease, heart attack, and stroke, retinopathy and vision loss, hearing loss, foot damage such as infections and sores that don't heal, depression, dementia. Treatment of diabetes. Diabetes is managed by a variety of drugs prescribed by doctors. Some of these medications are given orally, while others are administered intravenously. We strongly recommend that you consult your doctor if you suspect that you have diabetes. Diabetes and diet. Diabetes management begins with a healthy diet. In some circumstances, simply modifying your diet may be sufficient to control the illness. Take home. Some varieties of diabetes, such as type 1, are caused by events beyond your control. Others, like type 2, can be avoided by making better eating choices, increasing physical exercise, and losing weight. Consult your doctor about potential diabetes concerns. If you are at risk, have your blood sugar checked and follow your doctor's recommendations for blood sugar management.